Hi there, this is Janje, and you are watching Health Talk with Janje. To my followers, my subscribers, family, friends, thank you guys so much for your support. If today is your very first time tuning into this channel, I want to say thank you so much and welcome. I hope today will not be your last time either. So today I am going to be talking about heart disease, and I'm going to be sharing some important facts that can save your life. Do you know that research shows that African Americans have a 30% greater chance of dying from heart disease than white Americans? How scary is that? So stay tuned and let's get started. Okay, so first thing first, let's get this out of the way for copyright and disclaimer. All the videos, all the images and record songs and graphics that's going to be used in this video or on my channel, whether in my past videos or in my future videos, they belong to their respective owners. And I or this channel, Health Talk with Janje, does not claim any rights over any of them. As a disclaimer, this video and any of my other videos in the past or my future video is for information purpose only. It does not form any professional relationship. It does not constitute receiving professional medical advice and does not, absolutely not, replace the opinions of uh, of your healthcare providers. Always seek advice from your doctor or other qualified health provider with any questions that you may have for any medical issues or concern. Please never disregard professional medical advice or delay in seeking it because of something that you will watch on this video or something that you may have read or seen on Health Talk with Janji. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided by Health Talk with John Jay is solely at your own risk. Thank you. Okay, so moving into our discussion for today. So first thing first, the objectives for the discussion are I'm going to be discussing a little bit of statistics of heart disease. I'm going to be talking about the cause and common types of heart disease, sharing some symptoms of heart disease, going over some of the risk factors, meaning what puts you at a higher chance for getting heart disease, whether currently or in the future as you go on in life. I'm going to be sharing some ways that you can protect yourself, certain steps that you can take now to protect yourself or lower your risk for getting heart disease. I will be concluding this topic or this video. And then, of course, my last slide will be references that I use to build up the content for this video. All right, so statistics of heart disease. So, do you know that heart disease is the leading cause of death in the United States and around the world? Research shows that one person dies every 36 seconds. Imagine every 36 seconds, not minutes, not hours. Every 36 seconds, one person dies from heart disease. And about 655,000 Americans die every year. And this is according to the Center for Disease Control and Prevention. Okay, so heart disease is very serious, and this is why I'm bringing this video so that we can be aware of what it is, and what are steps that we can take to lower our risks, what are and for us to be able to better understand if we have some things in our life that put us at higher risk for getting heart disease. So this is a very serious topic, and I hope you will take the information and not just listen to it or watch the video, but also put it to practice and take those necessary steps that you can take for yourself, for your family member, or a loved one. Okay, so now we are into the cause and common type of heart disease. So the cause of heart disease Heart disease is caused by buildup of plaque or plaque. When plaque build up inside the walls of your heart's arteries, of the heart arteries. All right, so what are arteries? The arteries are simply the blood vessels that carry oxygen-rich blood throughout your entire body. So we have arteries are the ones that carry oxygen-rich blood that is needed for your heart to work well, for your kidneys, for all the different systems in the human body. So the arteries are the vessels that are used to carry this blood all over the body. Now, these arteries or vessel are like tube, almost like straw, the straw that you can use to drink your juice from or your soda. That's how it looks. So, but this plaque, they build up inside the wall. So, like you have your straw, you have the outside part of the straw, and then you have the. Okay, so as I was saying, so the arteries they look like straw. So let me see if I can get my pointer to work. Let me do this. So if you see up here, just follow the red dot. I'm drawing a circle. You will see. So this is your heart artery. This is how it looks. All right. This is a healthy artery. You see how outside looks nice and smooth and inside is nice. The inside part, see, in here is nice and clear. All right. But then heart disease is caused by plaque built up inside the walls of the artery. And these plaque, they can grow. So plaque are usually substances that are present inside the blood anyway. So they are like fat, calcium, cholesterol. Those are all substances that we carry in our blood anyway to begin with. So these things accumulate and build up inside this wall of your artery. Now, if you look at the second picture next to this one, you will see how the artery is becoming partially blocked. You see how the plaque has accumulated inside this wall? You know, blood can still flow through this, but it's partially blocked. And then if you look at the third diagram here, you can see this is pretty much a blocked artery. So it's going to be almost impossible to get the quantity of blood that you need to supply the entire body to get through this little opening here because this entire artery has been filled with plaque. Okay, so this plaque can grow and it can cause the arteries to become narrow, meaning it can become narrow and it can become hard too, and that's how heart disease develop. So if you look down here below this top diagram, you will see here. So this is an example of inside of an artery, how the buildup of plaque has caused this artery to narrow. You see all here? This is all plaque built up right here. So this artery has become so narrow that the quantity of blood that you need to get to all your body that this artery will transport, if it was nice and healthy, is going to be reduced greatly. Okay? And the types of heart disease, the most common type of heart disease is called coronary heart disease. Okay? Coronary heart disease. And this type of heart disease occurs when this plaque is in the arteries that carry blood to the heart. Okay? When the arteries, because the different arteries carry blood to different part of the body. So this coronary artery disease is when the arteries that's responsible for transporting the blood to the heart is filled with plaque and it has caused it to be narrow and become hard. This is what caused the coronary artery disease, and this type is the most common type of heart disease. And this can lead to chest pain, and it can ultimately lead to you having a heart attack. All right. Now the other two are carotid artery disease. So your carotid artery are the two large veins that runs on both sides of your neck down here. So when these ones become blocked with plaque, then it can cause carotid artery disease. Okay, and this one is the one that carries the supply of blood, oxygen-rich blood to our brain. So when this artery has been narrow, it has become hardened because of all this plaque built up, it can lead to a stroke. So this is what causes a stroke. And then the third heart disease is the peripheral artery disease. The peripheral artery are the arteries that carry blood, oxygen-rich blood down to your legs, okay? It carries the blood down to your legs. So when this artery has been narrow and hard because of plaque buildup, this one can cause some problems with your legs. You will have pain in your legs and things like that, okay? So this is the cause of heart disease, and these are some of the different types of heart disease. Now, this is not all inclusive. I'm just, trying to bring the, trying to shorten it as much as I can, just so we can get the main concept. Okay, but the most common one is the coronary artery disease. Okay. All right, so moving on to symptoms. So again, the key thing to remember is not everybody will have symptoms of heart disease. So you may have heart disease and not even know that you have heart disease because it's different for everybody. Another person may have symptoms and may have heart disease and have all these symptoms, and yet another person may have heart disease and not have any symptoms at all until they end up with a heart attack and end up in the hospital. So not everybody will have symptoms. Some of the common symptoms for heart disease, for a heart attack, you will usually experience chest pain, and it will be like a crushing chest pain. If you look in the diagram here, right here, you see how this guy in the picture is holding his chest. So it's going to be an unusual chest pain, will be a crushing chest pain. Some people describe it as they feel like an elephant is sitting on their chest. And then sometimes chest pain will not just stay there, but you will feel it, especially for men, it will run down their left arm. Sometimes you will feel it in your lower back. So for heart attack symptoms, it's chest pain or discomfort. You will have shortness of breath, meaning it will be hard for you to breathe or even to speak in a full sentence without catching your breath, like uh, one something to eat. So that's what shortness of just illustration of shortness of breath. So it's chest pain or discomfort, shortness of breath. You may have neck or upper back pain. You may have experienced heartburn, indigestion, no, nausea and vomiting. Nausea simply means you feel like you want to vomit, but you're not actually vomiting. That's the medical term for feeling like you want to vomit is nausea. So it's nausea, vomiting, and then extreme fatigue. Fatigue is pretty much tiredness, but this tiredness is so extreme to the point where you may not even be able to lift your arm from the side of your body or even get all of that. You just feel completely wiped out of all your energy. So you may have dizziness and you may have some upper body discomfort. Again, this may not be the same for everybody, but or some people may have one of the symptoms and not have any of the other symptoms, or you may have two or more and not have the other one. Now, for heart failure, someone who is experiencing heart failure will have shortness of breath again. They will have experienced the same fatigue, or they will have swelling in their neck veins. So the neck veins will be kind of bulging out. So swelling in your neck veins, you'll have swelling in your abdomen, which is also another word for stomach. Your feet will become swelling, like you see in the diagram up here. Um, Another name for swelling is edema. So you may have edema or swelling of your feet, your ankles, or legs. So again, this is not all inclusive. There are many more other symptoms, and everybody may not have any symptoms. Some people may not have any symptoms at all, and everyone may not have all of these symptoms. You may have one and not the other. You may have two or more, but this is not all inclusive. This is just some of the most common symptoms that are reported when it comes to heart disease, someone that is experiencing a heart attack, or someone who may be in heart failure. All right, so you may be asking yourself, then, what are my risk factor? Meaning, what will put me at a higher chance of developing heart disease? So these are just some of the risk factors based on the research that I conducted. That, again, anything that I'm saying here is not all inclusive. There may be many more, but I'm just trying to summarize it as much as I can. So the first and most important risk factor is a family history of heart disease. So my people, when you go to the doctor or you go to the hospital, or let's say you call 911 and they ask you, what is your family history? It's not because they want to do anything with your family or they're digging to find information, but these are important things that the doctor needs to know. So if you have a family history of heart disease, meaning maybe your mother or your mom died from heart disease, and at what age, if they died at a younger age or older age, maybe your like most like your immediate family, your parents, your siblings, or you have auntie, uncles that may, if there's that may have a history of heart disease. So family history is very important. So when the doctor then asks you or the nurses ask you about your family history, please, my people, let us be able to share the medical history of our family because those are important things that can help the doctor better take care of you. Knowing if your mom had cancer, if your mom had heart disease, or your pa have cancer or heart disease, whether heart attack or heart failure, those are important history. Family history is the number one risk factor that will increase, that will put you at a higher chance of possibly getting heart disease if there was someone in your family that have heart disease, especially if they were closer to you, like your mom, your pa, your sisters, or your aunties or uncles. Now, the next risk factor is hypertension. Again, hypertension simply means high blood pressure, or like we say in Liberia, high BP. So high blood pressure is another risk factor. High cholesterol is another risk factor. Now, most of our foods are high in cholesterol. We eat palm oil or red oil. We eat a lot of fried foods. Those are things that will make your cholesterol to run high, and that can put you at risk too for developing heart disease. Uh, there are certain habits too, like smoking or drinking alcoholic beverages. Those are things that will increase your risk for heart disease. If you have diabetes, meaning if you have diabetes, not so much if you're born with diabetes, but though if you were diagnosed with diabetes at a later time in your life. So diabetes, if you have stress, lack of exercise in your life, if you are obese, meaning you are overweight, and then eating a diet that is not healthy, an unhealthy diet. So these are all things that will increase your risk for getting heart disease at some point in your life. Okay. So this is again is not all inclusive. It's just some of the basic risk factors. Okay, so I know you may be saying, Janke, you have given us all this information. Yeah, but what can we do to protect ourselves? Like, what can I do to protect myself, protect my loved ones, or to lower my chances for getting heart disease? Now, bear in mind that most of the things that we need to do are all lifestyle changes. Most of them are lifestyle changes. So here we go again. The very first step, this is not John just saying, this is based on research, is to know your family's history for heart disease. Whether someone in your family had or has heart disease or died from heart disease, whether it be your mother, your father, your auntie, your uncle, your sister, your brother, knowing your family's history for heart disease is the first step that you can take to protect or decrease your risk for developing heart disease. Next, if you are a smoker, you want to plan on stopping smoking. Okay, so I know it's not easy because this is an addictive habit that once you start, it's hard to break away from. But just taking those little steps. If you are smoking one pack of cigarette a day, cutting back to maybe half pack a day, can and then every time if you decrease it either by the day or by the week, and then before you know, you don't even want to smell or taste cigarette. Okay, if you are someone who drinks, you want to limit or stop alcohol intake. Try to eat a healthy diet. This is not only important for lowering your risk for heart disease, but it will also help with your cholesterol level. It will also help you with your blood pressure. It will help your diabetes, and it will help you lose weight. Okay. Then you want to try to incorporate exercise in your lifestyle. Be more physically active. Okay. I know, yeah, it's busy in America. Most people work And some people work more than one jobs. And then sometimes you, after working outside, you come home, you work. There are people that are single moms like myself, raising six children of my own. I know it can be busy, and sometimes it's hard to squeeze in that time to exercise. But you know, you want to take care of yourself first. You always have to take care of the caregiver. You are the caregiver. You have to care for this body that God has given unto you. You have to care for yourself, for your children, for your family, for your spouse. Okay. So you can plan on doing, maybe it's getting nice outside, taking 30 minutes walk 3 times a week, you know, walking outside, jogging, running, you know, but just try to incorporate some exercise into your daily life. Reducing stress. This one is big. I right here sitting here, I am a witness to this. There was a time in my life where I was so stressed, and I personally was experiencing heart issue. And literally, I will feel my heart beating, and then it will stop. And when it stopped, I would get lightheaded, and I would just feel this funny feeling in my head. And then sometimes it would just beat fast and then stop beat fast, and my heartbeat was so irregular. I remember seeing my regular doctor. I was sent to a heart doctor. They did so many tests on me, ultrasound of my heart. They had me wear this monitor. It's called a heart monitor for 24 hours. And for 72 hours, it was just, you know, keeping record of every time my heart would beat and start beating. So they did all of those tests, and they found out that there was nothing wrong with me. I was just stressed. So I had to find a way to reduce stress in my life. So I get it. It's not easy unless you are walking that walk. It's hard to say, oh, stop stressing. But with God, all things are possible. And I'm here today, and I can tell you, and I am a testimony. So God's a miracle working power. He is the God of impossible. He said, depend on me, bring your burden before me. So if there's things that you have no control over, worry cannot help. Only God can help you. Okay? Reduce stress, and keep your blood pressure and your blood sugar under control. So these are just some important steps, and get it again, these are all lifestyle changes that we can make that will help lower your risks or decrease your chances of developing heart disease. All right, so we have come to the end of this video. So to conclude, heart disease is very serious, my people. Um, we only have one heart, okay? And it's hard to get a heart transplant. You only have one heart, so you want to protect your heart. This is a very serious disease. And again, just to recap, it's caused when plaque build up, which can be dangerous when this plaque build up inside the walls of your arteries. And this plaque build up can be very dangerous. It can lead to a heart attack, and it can lead to a stroke. Okay, heart attack, stroke, heart failure. It can cause pains in your legs, where when you have sores on your legs, it won't heal because the blood flow to your legs that's supposed to help with healing has been greatly decreased. So there is no blood that's going to your legs, especially people with diabetes that have sores or also on their legs or their feet or their toes because of diabetes. These vessels have arteries have become so narrow that the blood that's supposed to help with healing cannot get to their legs. So they have pain in their legs. They have sores don't heal, and then they end up getting their foot cut amputation or their toes amputated. Okay, so knowing the risk factor, knowing the symptoms of heart disease, making the necessary lifestyle changes, and seeking early medical advice and treatment can save your life. It can save your loved one. It can save your family. Remember to take charge of your health and take care of the body that the Almighty God has given unto you. Thank you. Thanks for watching my video. If you like what you heard, try to make the necessary changes. This is very important. Hearing without action is like meaningless. So I'm hoping you guys will make the best of these videos by, you know, adapting those necessary lifestyle changes that you need to take to live a long, healthy life. All right, so please subscribe, like, and share this video with your family, your friends, and your loved ones. Be blessed and stay safe until we meet again. Bye.